Welcome to this module on stroke. In this session, we will cover the types, causes, clinical features, diagnosis, management, and complications associated with stroke, providing a comprehensive understanding of this critical condition. Stroke, also called a cerebrovascular accident, occurs when the blood supply to a part of the brain is interrupted or significantly reduced. This deprives brain tissue of oxygen and essential nutrients, leading to rapid cell death. There are three main types of stroke. The most common is ischemic stroke, which accounts for about 85% of cases and results from a blockage in a blood vessel due to a clot. Hemorrhagic stroke, which makes up around 15%, is caused by a ruptured blood vessel leading to bleeding in or around the brain. A transient ischemic attack is a brief, temporary disruption in blood flow, often called a mini-stroke, with symptoms typically resolving within 24 hours. Several risk factors increase the likelihood of having a stroke. The most significant is hypertension or high blood pressure. Other common contributors include diabetes mellitus, smoking, and atrial fibrillation, a heart rhythm disorder that can lead to clot formation. High cholesterol levels, obesity, and a sedentary lifestyle also play major roles in stroke development. Managing these risk factors is essential for both prevention and long-term brain health. Stroke presents with sudden and often dramatic symptoms. Patients may experience sudden weakness or numbness, typically affecting one side of the body. Slurred speech or complete inability to speak may occur, along with sudden confusion. Vision problems, such as blurred or double vision, are also common. Loss of balance or coordination can be an early sign, and in hemorrhagic strokes, a sudden, severe headache, often described as the worst headache of one's life, may be the key symptom. Prompt recognition and treatment are critical to minimize brain injury. Management of stroke depends on the type. In ischemic stroke, immediate administration of intravenous thrombolytic therapy within 4.5 hours of symptom onset is critical. Antiplatelet agents like aspirin or clopidogrel are used to prevent further clot formation. Managing underlying risk factors such as hypertension and diabetes, along with initiating statin therapy, are essential for secondary prevention. In hemorrhagic stroke, the primary goals are controlling blood pressure to prevent further bleeding and considering neurosurgical interventions when necessary. Managing increased intracranial pressure with agents like mannitol may also be required to protect brain tissue. Stroke can lead to several serious complications. Many survivors are left with permanent neurological deficits, such as paralysis or speech difficulties. Aspiration pneumonia is a common risk, especially in patients with impaired swallowing. Immobility following a stroke increases the risk of deep vein thrombosis and pulmonary embolism. Additionally, stroke survivors often experience depression due to functional limitations. In severe cases, stroke can unfortunately lead to death. To summarize, stroke is a sudden disruption of blood flow to the brain, leading to neurological deficits. It can be ischemic, hemorrhagic, or a transient ischemic attack. Major risk factors include hypertension, diabetes, smoking, and atrial fibrillation. Clinically, patients often present with sudden weakness, speech impairment, or vision problems. Management strategies differ based on the stroke type, but aim to restore circulation or control bleeding. Complications can be severe, including long-term disability, infections, deep vein thrombosis, emotional challenges, and even death. Early recognition and prompt treatment are critical for improving outcomes.